Swadika and good afternoon. Welcome back to the English language summary of the daily press brief live from the Center for COVID-19 Situation Administration, or the CCSA. For today's briefing, which is for Friday, the 2nd of July 2021, I will be following and summarizing the briefings from both Dr. Apisamai Sirangsan, the assistant spokesperson from the CCSA, and also Dr. Chawetsan Namwat, the director of Disease Control Division for the Department of Disease Control, who will be giving once a week an overall briefing of an overall picture of the vaccination drive in Thailand and any expert findings on undesired or severe symptoms which have resulted from vaccinations, so that we can be as transparent as possible and give the public all the information that's needed. Today, Dr. Chawetsan mentioned that overall vaccination drive is progressing very quickly. And he also mentioned that we have right now 3 different types of vaccines that are being administered to the people. We have 6.4 million doses of Sinovac, 3.7 million doses of AstraZeneca, and 57,830 doses of Sinopharm being administered to date. And also there have been reports of serious side effects for about 1,148 cases, and they've been investigated by expert researchers and medical staff, and we will give you any more detailed reports on these findings. But both Dr. Apisamai and Dr. Chawetsan stressed that in many countries with high vaccination rates, we continue to see increased numbers of infections. However, even after vaccinations, the numbers of fatalities have continued to decrease in those countries, and those who have been infected, about 10% of those who have been infected have had to be admitted to hospitals. So the risk of you being hospitalized after being vaccinated is much lower than not being vaccinated. And this is why it is important to continue to receive vaccinations, as the benefits clearly outweigh the risks. So we encourage all of you to follow up with your vaccination appointments. And our vaccination drive for this period will continue to stress vulnerable groups. And let me now take you to the latest figures of our vaccines that have been administered today in the slide we'll be showing on the screen very shortly. So as of yesterday, the 1st of July 2021, we have already surpassed the 10 million doses benchmark in our vaccination program. So we've a total of exactly 10.22 million doses of vaccines administered. And out of this number, 7.3 million persons have received their first doses, and 2.8 million persons have received their second doses. And this brings us to the equivalent of 10.22% of the whole population. And for those in Bangkok, the vaccination rate right now has we've achieved a rate of 8.18% of the total population in Bangkok. Also, the Secretary General of Julapon Royal Academy has revealed that 1 million doses of Sinopharm vaccines are due to arrive in Thailand in the next 2 days, so that's very good news. And the vaccines will soon be distributed to organizations and entities that have put in a request for purchasing at the earliest opportunity. And this will definitely assist in the national efforts to increase our inoculation drive. Now let me turn your attention to today's statistics. You'll be seeing on the slide, on the screen very shortly, a slide of the numbers of new confirmed cases. We have today standing at 6,087 cases, and we have to date 54,440 active cases, patients being treated in hospitals, and 2,002 persons are in critical condition, while 579 are on ventilators. The total number of new recoveries today stand at 3,638 persons, and I regret to say that we have reached a new high for numbers of fatalities today, standing at 61. And Dr. Apisamai just mentioned right now that within the new number of fatalities, 70% are those of the vulnerable groups, those who are over 60 years of age. And 80% continue to be patients with underlying risks or medical conditions. And there are 4% who are medical personnel who have succumbed to the disease. And so this is a risk that continues to worry us. She also mentioned that among all the patients, out of 100 infected persons, we could find about 5 who could experience severe respiratory symptoms, and within 10 of those who are on respiratory machines, there could be about 1 fatality, and therefore the situation in Thailand continues to be worrying, and therefore Bangkok continues to be the epicenter of local transmissions, where new infections continue to surpass the number of recoveries, and therefore the CCSA has requested authorities to address this problem immediately by both increasing bed capacities and by adopting new quarantine measures within the problem communities, or these will be called community isolation measures. And Bangkok governor will be discussing the details with the authorities concerned to address this problem and to determine and to fine-tune some standard operational procedures. So let me, and also in an effort to help address the increasing number of patients, the CCSA has asked physicians from all over the country. We have now 144 physicians who are experts in fields of not only general practitioners but also respiratory systems, and those who are experts in intensive care. They will come from all over the country to help Bangkok manage and cope with the increasing number of patients. And we welcome this help and support from all the provinces. Bangkok now has 113 clusters of infections under close surveillance. There is good news, however, because 27 former clusters of infections in Bangkok have been cleared free from new infections. And while Bangkok is actually accounts for 39% of the whole new infections of the country, and therefore The CCSA has asked the public to refrain from interprovincial travel and to limit traveling only to essential purposes to lessen the risk of spreading the virus from Bangkok to other parts of the country. So let me show a slide on the screen right now on the 10 provinces which have reported the highest number of COVID cases today. And these are Bangkok, which is also a new high at 2,267 cases, followed by Samut Prakan at 522, Nonthaburi, Samut Sakhon, Pathum Thani, Chonburi, Yala, Pattani, and Songkhla, and also Narathiwat. You can see the numbers on the screen right now. So because these numbers continue to be high, the authorities concerned and the Ministry of Public Health have given us some new observations that we are now experiencing an increased increased cases of Delta variants within the country. So the characteristic of the Delta variant is that it's easily transmissible, and it will likely affect those in risk groups more severely than other segments of the population. And therefore our vaccine drive will now continue to emphasize the most vulnerable groups, and these continue to be the elderly and those with the 7 underlying diseases. And transmissions among family members still remains a persistent cause for concern in this current wave of COVID infections. So with all of that, let me turn you now to a small summary of what happened yesterday with Phuket Sandbox. As Kun Natapanu mentioned yesterday, the Prime Minister paid a visit to Phuket and observed the launching of the Phuket Sandbox scheme. He personally inspected the readiness and the safety measures which are now put in place at a number of key tourism-related sites. And these include the main entry-exit points of Phuket International Airport and also the EOC Phuket Tourism Sandbox Operations Center. And afterwards, he also chaired a follow-up meeting on the Phuket Sandbox scheme with the local authorities and also authorities from Bangkok. And in total, yesterday, we saw 347 passengers on the flights from Israel, from the United Arab Emirates, from Qatar, and Singapore in Phuket. So the Prime Minister himself greeted our international visitors. And these first group of international travelers are now no longer required to undergo quarantine. And this will be the first time since over a year ago when we first introduced our quarantine measures for international arrivals that these passengers will never have to be in quarantine. As these travelers enter Phuket, they will also undergo several measures to guarantee that they will not, if there are any persons who may be infected or any underlying infections, that these will be detected as well. So they will be going through screening procedures, and also they are required to download applications, mobile applications, to track their movements within Phuket. And they are also required to take swab samples for RT-PCR testing. And so they are probably now resting very well in their respective hotels and wait for the results of their RT-PCR testing before they move back to they resume their touring or their activities for recreation activities in Phuket. So Phuket, yes, is still the pilot destination for the subsequent reopening of other destinations in the country. And we will follow this up on the 15th of July with other provinces with other islands of Sulathani province, and this includes Got Samui, Got Phangan, and Got Tau on the 15th of July, should the Phuket model prove itself to be successful. However, authorities will continue to closely monitor the progress as Phuket reopens, and if needed, any adjustments as needed can be executed to address any changes in circumstances. Phuket has already progressed very well with its vaccination drive. 70.25% of the population have already received their first doses, and over 60% their second dose. So this will continue as they receive international travelers. And also within Got Samui, Got Phangan, and Got Tau, the vaccination drive is progressing very fast as well, so that they can very soon open up their islands later on to follow the Phuket model. So before I end my briefing today, I'd like to remind our audience that what we are dealing with today is a global pandemic which brings challenges at an unprecedented scale, and these challenges are multi-dimensional because they do not only cause hundreds and thousands of deaths in every corner of the world, but they also affect our health, our social lives, and our economic livelihoods. Because of the restrictions that we have had to impose in order to limit risks to public health and in order to save lives. And it has so profoundly affected our economies in the sense that even after we have been able to control the disease, our economies will still need time to recover and recalibrate. And this is why the measures we have in place, be it physical restrictions or reopening the country in selected provinces, they all need to be multi-dimensional too. To solve a complex challenge, our approach cannot be one-dimensional, and therefore the CCSA needs the collective cooperation of the public and understanding to continue to comply with our measures, which will try to target the problems precisely where remedy is needed. And at the same time, in places that are ready to reopen, we need to explore modalities to enable the economy to move forward and save businesses and livelihoods at the grassroots level. So we appreciate all the personal sacrifices continued to be made by all sectors of society, especially our medical personnel, which is crucial at these very trying times. So sacrifices, personal sacrifices from everybody right now, including just very small sacrifices of refraining from social gatherings, keeping distance from family members, as well as staying at home as much as possible, can make huge differences to our efforts to curb the virus and will help alleviate the burden of our medical personnel who continue to work around the clock even after a year and a half. This is all I have for you today. Kindly remember to practice DMHTTA, and as we continue to battle this current wave of COVID infections, we'll be back with the English summary of the daily press briefing on Monday again. Thank you for your kind attention. ขอบคุณค่ะ สวัสดีค่ะ
ครับขอบคุณนะครับท่าน